So folks are watching this sort of parade go by. Weeks late, months late before it make a difference. In Boston, in Connecticut, other states, they're rolling it back and looking forward to an end to the latest wave of COVID. But here in Rhode Island, the charade continues. Government will save you. Government will be your friend. So we're here at today's pre-press conference, a pregame to the press conference that's about to take place. We're in East Providence at some type of distribution facility. Dr. McDonald actually probably doing as much useful work as he's going to do in the next few months. Astonishingly enough, I'm not usually this editorial, but living testament to failure standing in front of us is, of course, Dr. McDonald. He lied during Superior Court proceedings. He was caught in the lie. But folks getting set up now. This is the Peter principle come to full fruition. Someone rising to the level of their own incompetence. The gentleman in the center with the blue tie is in no way competent to run a public health administration. He's displayed that time and time again, and yet here we are. The answer to getting rid of Dr. Scott was to elevate the stupidity that occupies the lowest rung below him.
Come right this way, young lady. Yeah? Come on in.
Let's move a little closer. So again, displaying probably the highest skill set level that he's going to actually display as head of the Department of Health. Yes, he lied under oath, thoroughly corrupt, and yet this administration is elevating this individual instead of firing him. I have no doubt that this gentleman is a thoroughly competent doctor. I have no doubt that he's obviously an intelligent individual, but he is in no way prepared to run a public health administration. Dr. McDonald, do you regret misspeaking under oath? Let the charade continue. Politicians doing the most important thing they can, which is acting like they're doing something.
How are you doing? Good. How are you?
And we'll roll it back. I doubt I will. This is sort of how this crowd rolls. I'll get to ask them, but they won't answer. Feeling a little bitter today. I don't know. Maybe it's a cold. So bear with us, folks, as this continues.
When I go around the stairs, I agree with you. So this is getting distributed in every community. Take care. Stay out of the store this weekend. I'm going to give you a mask. too.
Why not you vote on the press conference for those parental bills? Was it making the same discount?
I do remember that. I was on a call with Ryan.
Ryan Lukowitz.
Yes, yesterday on his podcast.
Yes.
So he did that white paint event in
Yeah.
Cranston.
I was there.
You were there? Yeah. Okay.
I'm educated.
Well, thank you so much for saying hello. And thank you for coming.
So, folks, hang in there. The governor is handing out tests and masks and stuff. I'm sure the theatrics will begin soon.
Right there in the back. Clam cake. Steve, you have a fan over here.
My body's too wide.
You want to come over here for a little bit? Very important message. Need you here. All the shots. Good.
I'm not running, don't worry.
Clam cake, look out. Clam cake, look out. Right this way, no block. Ma'am, right this way.
This way, miss.
Right this way.
Thank you for the
Like the little teeth of block. Right that way.
Doing our best. That's all. That's what we're trying to do. Good.
Hello. Hi. Thank
Right this way.
How's it look? Rolled up? Are there any more?
I can't see what the last box
Oh, yeah? Oh, yeah. Good afternoon, everyone.
We also have one more gentleman coming through to get a test kit.
Wonderful. Okay.
Just say something.
Testing, testing. 1, 2, 3.
Right. Thank you.
Let's get this gentleman out of the way with his. There you go, sir. Go. Okay, yourself. I just want to start off by, my name is Bob Silva, Mayor of East Providence. I want to thank you all for being here today and welcome you to the city of East Providence. I want to thank the personnel from Ferlin Group for allowing us to do this here in their facility. Our EMA team, who's here with us from the fire department, have been planning these distributions throughout the city with all our high rises. This was already on the schedule, and we found out that the governor wanted to have a press conference. We welcome him here today. Governor McKee's, Lieutenant Governor Sabina Matos, Director Mark Pappas, in charge of the EMA for the state of Rhode Island. We welcome you and the rest of the team, Dr. McDonald and everybody else. So thank you all for being here, and Governor, I'll turn it over to you.
Thank you, Mayor, and thank you for your leadership. Being here today, having cameras here, seeing residents receive test kits and masks, it delivers a great message around the whole state of Rhode Island, because not only is Mayor De Silva really stepping up with his team, but also municipal leaders around the state of Rhode Island are doing the exact same thing. So getting that message out, how important it is to be tested, wear your masks, and get your booster shots. It's just a great spot to be here. We love getting our feet on the ground. I think it's really important to do that. So following this morning's announcement that Dr. McDonald will assume the day-to-day responsibilities of the Department of Health as Department of Health Director, we wanted to get out in the community and start introducing him to some of the municipal leaders and partners that have been supporting our COVID response, over the last almost 2 years. I would also say that, when there is a change of leadership, it's very important to get the leadership that's going to carry us forward out in front of people. We thank those who have been in leadership as well as Dr. Alexander Scott. But we want to make sure that the people know that we've announced an experienced bench of leaders to support Dr. McDonald. Anna Novas, former Assistant Secretary of the Executive Office of Health and Human Services, and experience in the Department of Health. My Deputy Chief of Staff, one of our Deputy Chief of Staff, Pastor Chris Abilene, he's been helping in many areas, and he's going to take an early spot in the Department of Health, so that we make sure that the transition goes smooth and that there's a good communication between our office and the Department of Health. Along with Ernie Almonte, Chief of Staff of the Lieutenant Governor, former Auditor General, and it's great to have a partner like Sabina that we saw a need to have someone like Ernie there on assignment, and so we're working that out in our offices. But it's another value, quite frankly, of a Lieutenant Governor and a Governor working like this. So thank you, Sabina, for making that happen. And I have full confidence in this team, and look forward to continuing to work with them. We'll be back on Tuesday afternoon for a full COVID briefing, but I do have some important updates regarding COVID to share with you today. On the rapid tests, today we're in East Providence, where rapid tests are being given out to our seniors. This is part of an initial 500,000 tests that the state secured a couple of weeks ago, and I was in Johnston outside in the cold weather on Saturday, handing them out just like we're providing these important test kits and masks to people here in East Providence today. But a big thank you again to Mayor De Silva and our municipal leaders for moving fast to get these test kits out the door. This is a very appropriate location to announce tomorrow. We'll be distributing an additional 500,000 at-home rapid tests. And thanks to Director Mark Pappas for his assistance in making all this happening in a way that is going to really be important to people in the state of Rhode Island. So just like the first batch, about 70% will go directly to the cities and towns of that next 500,000, and 30% will go to community partners in the health equity zones. This means that in about a month, right about a month time, 1 month period, 1 million at-home rapid test kits were handed out into the communities of 39 cities and towns in the state of Rhode Island. On the boosters, this is going to be a real focus for us over the next several weeks, is the booster shot. So right now, about 35% of all Rhode Islanders have received a booster shot. That's not enough. And we want to do much better than that 35%. And I know that we can get there. So we're going to really make sure that, just like when we were getting people vaccinated during the summer months last year, where it was an absolute top priority, and we made it that way with different levels of efforts to make sure that we were getting the message out. We're going to do that again, and one of Dr. McDonald's top priorities is going to be coming up with new strategies to get Rhode Islanders boosted. On the case numbers, I also want to briefly share encouraging news that our 7-day case average is beginning to decline. It's down about 48% from a week ago. And also our 7-day average for percent positive is also down from 18% last week to about 14% this week. And yesterday we were about 9%. On a national level, I want to give a little illustration of what that means to Rhode Island. So during the months that the Delta was first arriving, we were in the bottom 5 on infection rates and death rate, hospitalization rates. Today, we're in that middle of the 30s, 35. We want to be at the best, but I can tell you that the infection rate is going down, and I want to thank Rhode Islanders for doing the right thing and helping us, move this needle. Before I turn it over to the Lieutenant Governor, I just want to let Rhode Islanders know that we're monitoring the snowstorm very closely. I was on a call with the National Weather Service about an hour ago, and we have another storm briefing call right after this press conference. The update at this time is that everyone is still monitoring the storm, and the models show that there is potential for a good deal of snow that will fall on Saturday, but we'll have a better sense exactly the track of the storm tomorrow morning and throughout the course of the day. And of course, we'll stay in touch with everyone in terms of the storm threat and what that means for Rhode Islanders. And with that, I'll turn the mic over to Sabina Martos, our Lieutenant Governor. Sabina?
Good afternoon. Thank you, Governor. Thank you, Mayor Da Silva, for opening the door for us to be here today. I just want to take a few moments to say to the Rhode Islanders, the people of Rhode Island, I just want to say thank you. The numbers are going down, and if they're going down, it's because of your what you have been doing. You have been getting boosted, you have been getting vaccinated, you have been keeping the numbers of gathering small. You have been making sure that you wear your mask as often as possible. And if the numbers is going down, it's because you have been an active participant to make sure that happens. As you know, we continue to have the clinics for the vaccine. The vaccine are important. So we're still promoting the clinics. And this week, we're going to have clinics in different communities. Barrington, Coventry, East Greenwich, Jamestown. So get ready. If anyone that wants to get a booster or someone that wants to get the vaccine for the first time, let me know, because I'm celebrating every single individual that decides to get the vaccine, and I want to celebrate you. So let me know. I want to be there to celebrate you. This is important for us to get vaccinated. This is an important date also. I just want to remind everyone that we are working really hard to make sure that there are resources available out there. And I cannot let this moment pass without reminding everyone that we still have funds available through Rhode Island Housing for the rent relief fund, but also for the homeowners. I keep getting the phone calls always when we have the rent relief out, when there's going to be help for the homeowners. So we have funding available for the homeowners right now. Make sure that you go to the Rhode Island Housing website and get the information. We need to use these resources. As the governor said, we send the money to Washington, they send it to us, and we're not going to send it back, okay? So make sure you apply for that. Finally, I just want to take a moment and say that the governor and I have been talking about the importance of having the office of the governor and the lieutenant governor work in collaboration. And one day, the state of Rhode Island hopefully will make the change and have the governor, lieutenant governor in the same ticket. But right now, we are working together to make sure that we answer the call, the need that our community has, that the state of Rhode Island has. So I'm very glad to have this opportunity to work in collaboration with the governor and his team, and my team, and my chief of staff, Ernie Almonte, is going to be assisting the governor's team in this transition at the Department of Health. Ernie is someone that has great qualifications, has experience of working in government and the private sector, and understand what needs to be done. And I think that I want to thank him for his willingness to play this role, and I'm pretty sure that we are in good hands with him being part of this important transition with Dr. McDonald, also with Anna Levi's. So every Rhode Islander needs to know that our priority, the first thing that we're thinking about is what is the most important thing to keep the President of the State of Rhode Island safe. So we're glad to participate and collaborate with the governor to do that, and we're glad that Ernie is going to be part of that team. Thank you. With that, I'm going to turn it over to Dr. McDonald.
Yeah, so thank you, Governor McKee, and thank you, Lieutenant Governor Matos. And good afternoon, everybody. You all should know me by now. It's not like I'm new to you, right? And so we've met before, right? And I just want to talk a little about the Rhode Island Department of Health for a minute. The Rhode Island Department of Health is made of strong people, made of good people who do great work. It's an honor for me to step in during this time, to be an interim leader during this time. It's humbling to lead such great people, but I want to underscore, the quality of person that I work with is unlike anyone I've ever worked with in my entire career. I've been in the Navy, top-notch people. I've worked with the Indian Health Service, great people. The people at the Department of Health, just an amazing group of people, so it's an honor to be here. I just want to talk a little bit about the pandemic for a minute. So, this may seem like a pandemic that's never ending, but let me suggest to you, we've had 4 seasons of this pandemic. What I mean by 4 seasons of the pandemic is February 28th to March 17th of 21. So February 28th, 2020 to March 17th of 2021, we had the original COVID. From March 17th of 2021, St. Patrick's Day, to around the 4th of July, we had Alpha COVID, right? And so things have changed, right? And then we went into Delta COVID from 4th of July till Christmas time, right? And then after Christmas, we got the Omicron. And that's where we are now with Omicron COVID. So, we're in the 4th season of this pandemic, quite frankly. We have 36% of our population who's up to date with the vaccine. So we got vaccine available, but I got 36% of us who are up to date. What I really need people to focus on is kind of move away from the term fully vaccinated. If you've gotten the primary series, good for you. I'm glad you got the primary series. You've gotten 2 doses, that's great. What I need people to do is get that 3rd dose, like the governor said. I really need our population to get boosted, not just to get through this season, but to prepare us well for next year as well. Because by the way, as this season comes to a close, I worry about the future as well. Last thing I want to say to you right now is that, this pandemic has not always been in our control. It is in our control now. And I just want that to be something you kind of settle with. It's in our control now. People today got self-test kits. Here's what they're supposed to do with them. If you have symptoms, runny nose, cough, headache, feel tired, you should do a COVID test. If you have symptoms, you should test. The thing about Omicron COVID, it can sometimes be very subtle when it starts. So part of what I'm just telling you is you have subtle symptoms, please test yourself. If you're positive, it's a treatable pandemic. So we have treatment across the state right now. Now there's some national shortages, but right now there's monoclonal antibiotics, the GlaxoSmithKline products, the Trovimab's available. I have oral antivirals. I have some Paxlovid in this state at the 9 pharmacies, as well as some Molnupiravir. So there's some oral treatment here too. So I think we need to think about this like COVID's a preventable, treatable disease. We have the tools we need right now to get through this season and move on with our lives. With that, let me just stop, and then let me turn back to the governor for questions. Thanks, everybody.
Mark, you want to just give a update, or are you all? Okay, we'll take questions. Anybody that's here?
Dr. McDonald, do you have any willingness to take the job on a full-time basis, or do you want to rule that out?
Yeah, so I had a really great conversation with the governor the other day, and what I told Governor McKee was I want to help him. Tony Afonso was there, so I said, I want to be helpful. And he asked me if I would help the search committee. I met with the search committee yesterday. We had a great conversation. I'm going to help them as well. So, part of what I just want to say to you and to anyone else is, let me help the governor right now, okay? Let me help with that search for a permanent person, and we'll see where that brings us, okay? But we'll look together, but I'm just going to try to be helpful at this point.
Your hat in the ring? Are you going to throw your hat in the ring, so to speak?
I'm not trying to answer the question anything more than just honestly. I just want to be really helpful to the governor right now. and that's what we're gonna try to do. Is that fair?
If you were offered the job permanently, would you accept?
So let me just, I really like to just say what I mean what I say. I just want to help the governor right now, and can I just leave it at that for today, if that's okay with you guys right now? I don't mean to not give you a more of a specific answer, but please let me just help the governor right now. Let's get through this time and we'll see where it brings us, okay?
Governor, you said that you're going to have better relation, better communication now with your office and the health department. What happened before with Dr. Nicole Alessandro? You know, had a good relation?
No, I think that we're going to continue. I want the people to know that the combination of the people that we bring in and the people we have over there right now, we intend to have good communication. I think that what I was mentioning was with Pastor Chris being there, to have a more direct communication in a transition like this is really important. So we want to know everything that's happening in a way that, where before it was happening and it was doing well. I mean, we're not leading the country in testing unless there was good things happening. We're not leading the country in vaccinations unless good things were happening. But in a transition, I think that you need to be very proactive, and that's what we're doing right now. We're bringing in resources into the office, into the Department of Health, to make sure that this transition is very strong, and that the people in the state of Rhode Island understand that we're doing everything we can, and we've got a good team that's going to move us forward.
Governor, could you clean up exactly, it's our understanding, Dr. Scott comes to you and says, I want to resign. You say to her, I want you to stay. She says no, 2-week notice, and then I'll have my attorneys contact your attorneys to negotiate. When a director resigns, where is the negotiation? Because she ultimately, in doing that, resigned her position as director of the state. Now, she's entitled to the money for February, but how does it go from, she told Channel 12 that you offered her the money. How does this square where there's a negotiation if she resigned?
Well, first of all, the sequence was similar to what you just said.
Okay.
The doctor said she had a window of opportunity in more than one meeting. I asked her to stay. Each time it accelerated, there was a window of opportunity. When I have people that I work with that tell me they have a window of opportunity, we want to make sure that that happens, and that the transition, I ask for professional transition, right? So that's what's happened. And then in terms of, I believe there's a value to have, have an outgoing director be in a situation where that we can call on her if we need her, and there was certainly a negotiation in terms of what that value was. We went through that negotiation. I think we settled in a spot that makes sense. So for the state of Rhode Island and taxpayers.
Did she refuse to assist unless she was going to be compensated $46,000 a month?
So I'm just going to be very clear again on that, right? The sequence happened as I laid out just now.
Yes.
And it was a process over several weeks. As I said, it was a few weeks back. And there was a compensation in there that I believe that was made sense, and it was asked for, and we responded by saying, we'd like to have you on as a consultant. And I did offer that to her to come on as a consultant, and then we worked it out with the attorney. So I think that it is true that I said, consultant might be good. We really want to make sure the people in the state of Rhode Island are safe.
But she's not available the month of February.
She's available to us. She's on, she's taken some comp time which is legal to do and appropriate, and we certainly will have access to her during this time frame. And
was there an issue of money? Would she have stayed? Did she say, "Listen, I think I'm worth more. If you pay me more, I'll stay"? Is that what it was?
No, like I said, she felt as though she had a window of opportunity. That's her words. My words was stay, but if not, let us do a professional exiting strategy, and I believe that we are showing today that the people of the state of Rhode Island are being served very well.
So this wasn't a buyout? It wasn't a contract buyout?
No. And I think it's important that it wasn't a contract, by the way, right? That was statutorial, I'm going to miss the words here, but she was on a 5-year, not an agreement, right? She was on a 5-year term, statutorily, right? So, no, I think it's exactly what I just said. She said, the doctor said she had a window of opportunity. I asked her to stay. When that was not an option, we tried to figure out the best way to make sure that we had all professional hands on deck, and we've done that.
Can you tell me what that opportunity was?
No.
Governor, on the tests, would it have been better to have them here a month ago? You've even said that Omicron, the cases are declining. Would it have been better to have these here weeks ago when people were asking for it?
Well, first of all, let's talk about testing. 175,000 tests in a given week, just 2 weeks. So we're leading the country in testing. So I want to make sure that people in the state of Rhode Island know that that's a success, what we've done in the testing. Bringing in supplies right now in terms of the supply chain is a challenge for everyone, but that's why I gave a shout out to Mark Pappas. When he came on a few weeks back, we identified areas we wanted to get supplies, and we went out and got them. And so now we got the municipalities handing out tens of thousands of home test kits. That's a success story as far as I'm concerned. And 175,000 tests in a given week. And we said numerically 2 times what the second place state had. That's an enormous workload, and that's National Guard, it's Department of Health, right? It's IEMA, it's our municipal leaders, all our nurses out there. They've stood up and led the country in testing.
Governor McKee, where are the tests coming from? Are they coming from the federal government? You also mentioned a couple of weeks ago that you were reaching out to CVS and a company on the West Coast as well.
I think the first batch came from CVS, and the call that I had, and Mark might be able to kind of detail a little bit more on that question, if you'd like to do that, Mark, please.
Perfect. Vendors, private vendors, that have been secured over time. Abbott, other companies, CVS, that sort of thing.
And another follow-up, with the bulk of these tests, with all of these at-home tests that are going to be out there in the community, maybe this is a question for Dr. McDonald, are you concerned about the lack of self-reporting? Are people self-reporting these cases to the DOH? How is it changing the percent positive in Rhode Island? You say that Rhode Island is the testing leader, but are we still going to be a testing leader?
Yeah, there's no mandate for them to report, so we know the numbers are a little low. Dr. McDonald wants to take
Let me say, thank you, Director.
Sure.
So yes, obviously, not everybody who has a self-test is going to report to us. He was at the Senator Oversight Committee Monday night. Senator Acosta explained this to me too. Like, he said his kids were positive, he tested positive, so it's like he did the responsible thing, he did the right thing. He had self-tests and he used them, but he didn't know we have a website. So we have a website that can self-report. But yeah, we're not going to get all these people self-reporting to us. We understand that. So, it is going to change things. I'm following the hospital numbers a lot more closely, though. One thing that's kind of interesting now is, even just compared to like 8 days ago, there's 100 less people in the hospital than there was 8 days ago. Our hospitals are still stressed, still a lot going on there. They're still limiting what they can do here, but that's something where it's going to be more important to look at that. In aggregate, though, think about it this way. There's a lot of people doing self-tests. Some are going to be positive, a lot are going to be negative, but the main message I want to drive home to folks is you've got to self-test. You've got to know what to do with it, right? So it's really when you start having symptoms where you think you might have anything. Because one of the things about Omicron COVID is it just surprises people. It's subtle, and people just, like, I felt okay. And then so somebody, an amazing number of people told me they have it. They're just like, it just came out of the blue. And a couple days into it, and they didn't realize it. The thing is, why I want you to test early is I really prefer you not running around town positive for COVID. And, if you have symptoms for a couple days and you're running around town, you're just spreading it all the more. So that's why you can do that. So I hope that helps.
Dr.
Pat had one more question, John. Pat had a question.
Dr. McDonald, last week the CDC released reinfection data from California and New York that showed natural immunity to be superior to vaccination for preventing hospitalization and reinfection. Johns Hopkins University showed that the protection offered by natural immunity to last longer than that provided by vaccination. In light of these developments, is it in fact time to get people like Dr. Scully, to get the fired healthcare workers back to work? Is it time just to move past this seeming obstruction against scientific fact?
Yeah, so I think we have to look at all the studies that are out there. One of the things is, like, in the short term, and this is not surprising, right? In the short term, you're going to get natural immunity will last, but it doesn't last as long as vaccine immunity. One of the things we had recently on our podcast, Dr. Chin and I do a podcast called Public Health Out Loud. We had Dr. Joe Hogan on from the Brown School of Public Health, and he really looked at Rhode Island data. We have Rhode Island data that shows people who are vaccinated are doing better than people who are vaccinated, unvaccinated reinfection. So reinfection isn't offering protection. And one of the things you need to remember, this was true at the beginning of the pandemic, it's true now, is coronaviruses have been around for a long time. You don't get long-term immunity from a coronavirus. And that's why the vaccine's so important. The thing I think people drive home, though, is that if you're not up to date, you haven't had those 3 doses, that's what I need people to do here. So, to answer your question, no, I don't think we need a shift policy. What I do need people to understand is you really need to be up to date with that vaccine. So that means 3 doses of messenger RNA vaccine. If you're one of the 50,000 Rhode who got a Johnson & Johnson vaccine, you need a booster of that. You're good to go.
To follow up, wait a minute, follow up, please. All right, so you're denying the CDC. Basically, you're saying no to the Center for Disease Control.
Lynn has a question, and then we've got to wrap things up. I want to make sure everyone gets one.
Doctor, just what
Lynn
was your
and Michael?
reaction to the Washington Post? That showed the collapse of Kent Hospital. We're the only state in New England that the Biden administration had to send people in. The Boston Globe talked about the collapse of Rhode Island Hospital. How is this? What was your reaction to the Washington Post? It made us seem like it's third world care.
Well, it's definitely not third world care going on in Rhode Island. And, very thankful to get the federal support we're getting. I think one of the things we need to underscore right now is our healthcare workers are working as hard as possible. There is no collapse of any hospital in the state of Rhode Island. They're still taking care of patients. They have limited services, not doing as much elective surgery. But getting the supplemental staff is helpful. And this is a good example of how federal and states work in partnership. One of the things you see right now is Rhode Island we're dropping down, but other states are going to be in a different position here. We're going through Omicron wave. We're through this season almost. So we're heading in a decent direction. So our hospitals are in good shape. They're working hard. We partner with them all the time. They call me almost every day. I know what's going on in these places. My reaction is the people in Rhode Island are well served by our hospitals. The hospital workers are doing a great job, and I'm very thankful that they do that. And I think that we're going to be okay. And I think, quite frankly, in a couple weeks, 3-4 weeks, we're going to be in a much better place and maybe talking about something different. We'll see.
Lynn and then Michael, and we're going to get things going.
Governor, this is directed to you. In Massachusetts, the governor created emergency critical care orders for the whole state so that all hospitals had to cancel or postpone elective surgeries. In Rhode Island, the 2 major healthcare systems, Lifespan and Care New England, have done this, but Charter Care, which operates several smaller hospitals, as you know, has not done this. My first question is, did Charter Care hospital CEOs or anybody else in that organization ask you specifically not to introduce those kinds of mandatory, postponements of elective surgeries? And if not, why did you decide not to make a statewide order to help relieve all of the hospitals?
Well, we left it up to the hospitals to decide, and we know that those who did were so they needed to take that action. And like Dr. McDonald said, we're in conversations with the hospital leadership around the state of Rhode Island, and they feel as though that they can continue to have elective procedures and still take care of the patients. And I think that's positive for the state of Rhode Island, quite frankly. And also, I know that Governor Baker did something that I asked several weeks ago, was to determine who's going into the hospital with COVID and who's going into the hospital that have COVID. And I think we're going to have, on Tuesday, we should have some pretty good results on that as well. So we're monitoring what's happening in the other states. I'm in conversations with Governor Lamont. I'm in conversations with Governor Baker. And I think that aligning what we do in some cases makes sense, and in some cases it doesn't.
Michael,
so
last
let me just
question.
follow up.
Or one follow-up, and then Michael, and then we're all done.
Do you not agree with the doctors that I've talked to who say that actually there is a ripple effect when you allow some hospitals to continue doing elective surgeries, that they are actually have less room in their emergency departments and less staff to handle other types of procedures or emergencies, and that has a ripple effect on other hospitals, that they're affected too?
Well, again, with the infection rate going down, I believe that we've managed our way through the issues in the hospitals in a good way, and we expect that we'll have better news going forward. But we've taken some multiple actions relative to creating opportunities for the nurses to get in the hospitals earlier than procedurally. We also have done. We're working on urgent cares. We're working on multiple factors there. I believe it's working. Otherwise, we would be in a more difficult spot than we are right now. And right now, it's Rhode Island Hospital you're talking about. Lifespan. They felt as though that they needed to do that, and so we support that. And we've been through that hospital, walked through with the people there. And again, one of the things that's happened recently is the fact that I think that the FEMA staffing is going to be extended another couple of weeks down in Kent County.
So did any of the hospital CEOs or any of them ask you not to make a statewide order? Yes or no?
No, none of them asked me not to do it. What the discussion was, how do you want to handle it? And they individually took it, you know, on themselves individually how to do it. So no one asked me not to do it, and I didn't ask them not to do it. They made their decisions based on what was in the best interest of what they felt as though was for healthcare in their respective hospitals.
Michael, last question?
For Dr. McDonald, I realize that you've only been interim director for about 6 hours, but you've been here since the very beginning. And so I think this is a fair question. Knowing what you know now, I understand you and everyone else have been chasing a moving target to science. What should the state have done differently, and even what did the state do even wrong or in a way that should have been done better? And how do you see going forward based on those observations?
Yeah, you know, hindsight's 20/20 is an old expression, and I'm not sure it's helpful. You know, I think one of the things I'll say about this is, like, you know, when you start getting into try to blaming entities, like, I've just never seen blame lead to healing people and making anybody stronger. So I don't mean to not answer your question directly, but I'm just not sure it gets us anywhere positive. What I would say about going forward is, what I'd like to see happen going forward is, you know, we need to get our population well more immunized than they are right now. You know, one of the things Senator DePalma brought out at the Senate Budget Oversight meeting, he says, he's looking and saying, we're 34% up to date. He says, that's a problem. We got to fix that. I said, yes, Senator, that's the problem. Now we're at 36%, but that's the problem. The way going forward out of this season of the COVID, the Omicron season, is we need to get our population much more vaccinated. And that's going to help us get out of the Omicron season, but it's going to prepare us for next year. Because, by the way, folks, I don't know what the future holds. There's way more letters to the Greek alphabet. And what I want to make sure is we're protecting Rhode Island to make sure we're okay for the future. And that, my friends, is getting as many people boosted as possible. So if you haven't had that third dose, there's no waiting. We have a lot of vaccine availability. A lot of vaccine availability. In the beginning, that wasn't the case. Like, if you think back to a year ago right now, what you guys were talking to me about was, how can I get more people vaccinated? We were giving you everything we had at that point. Right now, though, we got plenty of vaccine. I just need more people coming forward with their arms, getting their vaccine. And I'm sorry there's a snowstorm on Saturday, because Saturday is a great day to get a vaccine. Because if you have a little immune response, you can sort of go with it. But it's like, I can't control the weather. There's a lot I can't control. What I can say to you, though, is that we can control this pandemic if we want to. And it would help a lot if we would just say, what's our solution? Because my solution is putting that solution in your arm and getting you to get that third vaccine. If I get that happening, we're talking about other fun things that we're not doing. So that's the best I can do for right now.
Well, let me
Thank you. I think that's going to be it, Michael. Thank you.
What you write.
Just one more. What about the mask? You want to keep the mask or you want to take it away?
Yeah, so we'll certainly be looking at that. I'm headed to a meeting at 3 o'clock, so I got to get out of here, and we'll be talking to the Senate President and the Speaker today about going forward in terms of what we're going to do with the emergency order.
All right, that's going to be it, Marion. Thank you. That's it. That's it.
100,000.
Governor, what do you think of Treasurer and Magazine are getting out of the...
Excuse me. Still waiting for you guys.
Like I said, when you got in, you know, everybody make a go.
Dr. McDonald, do you regret materially misrepresenting the behavior of Rhode Island government to Judge Lanphier in court? When you spoke about you regretted, you misspoke about childhood COVID deaths?
I actually did not misrepresent anything.
You said your words, you misspoke.
What I'm saying is there was 3 deaths with, not from. So I don't regret it. No, I said the truth.
So you don't regret lying?
Doctor, I have a question.
You lied to a judge and you walked it back. People want to know why.
We took questions tonight. Thank you.
Congratulations. That's what you work for.
I like it.
I'm in Providence.